Alright, now let us imagine a case scenario where a patient comes into your clinic with visual acuity of 20/50 in right eye and 20/20 in left eye. Right eye has underwent cataract surgery 3 years ago. Patient complains of gradual decrease in vision associated with glare in right eye for past few months. Now retinoscopy shows right eye minus 0.75 with minus 0.50 with no subjective acceptance and dull glow. Now fundus and rest everything was within normal limits. So what can be the cause of this decreased vision? As you can see in the video, when we are looking through the dilated pupil, we see the lens is not clear. Something whitish has formed on the lens. This is called posterior capsular opacification. Now, posterior capsular opacification is common complication that can occur after cataract surgery. It happens when the capsule which holds the artificial lens in place becomes cloudy or opaque. This can cause blurry vision, glare and other visual disturbances. Now, the treatment typically involves a quick, painless laser procedure called YAG laser capsulotomy, which clears the cloudy capsule and restores clear vision. Here, I would like to invite Mr. Rahul, who has been working as a consultant optometrist in cataract OPD, to go ahead and let us know about what could be the refractive changes as an optometrist we can see into the patient and how PCO is treated.
Refractive changes induced due to posterior capsular opacification are a myopic shift due to the increase in thickness of the posterior capsule, and then due to different thicknesses at different parts of the posterior capsule, astigmatism is also induced, which also causes a blurring of vision at varying distances for the patient. And if the PCO is only present monocularly, then due to the difference in the refractive power in both the eyes also causes discomfort for the patient and blurring of vision. And all of these symptoms can be very easily be treated with a YAG laser, which is done in the supervision of an ophthalmologist in an ophthalmology clinic. Usually what is done is the laser is used to remove the opacified posterior layer, and the normal passage of light through the crystalline lens is restored, thereby restoring clear vision for the patient. The pre-requirements for such a procedure are usually minimal, as no general anesthesia required to be done for this sort of a procedure. The only requirement to be done is the dilation of the pupil, and for the ample amount of pupil dilation, usually a tropicamide plus drop is preferred to perform this procedure. And then the patient is called for a 1 week post prognosis to check for the improvement in vision, glass prescription and ocular pressure monitoring.
Hey, thanks a lot, Rahul. You explained PCO in a way that everyone watching can easily understand. So basically, if we talk about the learnings from the session, I believe we have understood about PCO, the induced myopic shift and astigmatism due to capsular opacification, and also we have seen visual representations of PCO so that everyone could understand looking at PCO how it looks exactly. So we also understood how PCO is treated with YAG machine with the help of procedure called YAG capsulotomy. Let us also remember to get the refraction done for the patient in 1 week review so that patient gets the crystal clear vision, which is all at the end of the day we are chasing.